Hello, I'm Saira Neve, a senior clinician at the Anna Freud Centre. Welcome to our video series which aims to support staff working in a school, college or community setting to set up and run a peer support group that specifically aims to improve children and young people's mental health and emotional well-being. New figures on the prevalence of mental health issues in children and young people in England in 2017 found that 1 in 8 5 to 19-year-olds had at least one mental disorder, which would suggest that at least 3 pupils in every class may be experiencing a mental health problem. Many children and young people find it easier to talk to their peers first before they talk to others such as family members or professionals. Also, there is growing evidence that a peer-based discussion can influence a significant change for young people presenting with early emotional difficulties. As a result, there has been an increased drive to develop peer-based initiatives. Peer support programs aim to offer a preventative approach and an early intervention to address mental health needs. Peer support is an umbrella term to encompass an array of interventions and approaches that may be offered across different settings. These may include peer tutoring, peer coaching, peer mentoring, peer listening, befriending, and buddying. Peer support groups aimed at improving mental health and well-being involve a child or young person trained to support other young people through offering help and support, building emotional resilience, promoting well-being and positive mental health, and signposting to further support. Peer support uses the knowledge, skills and experience of young people in a planned and structured way to understand, support, inform and help develop the skills, understanding, confidence and self-awareness of other children and young people with whom they have something in common. Although approaches to peer support can be quite distinctive and varied, they offer 3 common features that include 1. Children and young people supporting each other. 2. Support being offered in a planned and structured way. 3. Supporters that are trained, supported and supervised to fulfill their roles. Peer support can be delivered in either a universal or targeted way. Providing support across a whole school or year group would be considered universal support. Targeted support would be building the positive well-being of a specific group where there is a known vulnerability to mental health difficulties, for instance, a child or young person who is in care. This video series is designed to be used alongside the Programme Facilitator Toolkit, training slides and programme resources for mentors aged 10 to 13 and 14 plus. It has been designed to offer key points that should be taken into account when embarking on peer support work, highlighting key things to consider as well as some of the potential risks, rather than as a series of instructions to follow so everyone develops and designs the same model. For further information, please review Chapter 1 in the Peer Support Programme Facilitator Toolkit.